If incontinence affects your quality of life, you can't do the things that you like to do, it's limiting you, then it's usually time to do something about it. I'm Dr. Jill Peters-Gee. I'm a urologist practicing at Women's Health Specialty Care in Farmington. I joined Women's Health because Women's Health Connecticut focuses on women's health, and what I do is female urology. So I wanted to be partners with physicians that had women's health as their top priority. Across the board, incontinence, which would be leaking of urine, affects probably 10% of women. As we age, the number goes up. We have young women in high school that see us, sometimes because of recurrent infections, sometimes because of leakage. As you get older, there's different things that happen at different times in your life. So a younger woman who's maybe just had children might have stress incontinence and leak with coughing or exercise or running after their kids. An older patient might have more of a problem with urgency or urge incontinence. And for us, that's a big problem because as you age, if you're running to the bathroom in the middle of the night, it's a big risk for slipping and falling and breaking a hip. The most common types of incontinence are stress incontinence, which would be coughing, sneezing, running, exercise type leakage, commonly associated with childbirth, but also something that happens as you age. The second type of incontinence is urge incontinence. We call that key in the door. It's when you have a sudden urge to void and you can't quite make it to the bathroom quick enough. And then there are combinations of what we call mixed incontinence, which is a mixture of stress and urge. There are risk factors associated with urinary incontinence. There's dietary irritants that can play a role. Drinking a lot of caffeine and artificial sweeteners is clearly linked with more urgency, more frequency. Medications can affect your continence. As you gain weight, sometimes that increases your risk of having certain, more stress incontinence. As we age and we go through menopause, and that affects our pelvic muscles and causes more problems with leakage. So the things that you can do to help prevent incontinence or maybe postpone incontinence is basically, eat and drink healthy, try to avoid excessive amounts of dietary irritants, try to maintain a healthy weight, and to do your pelvic muscle exercises. Kegel exercises are the standard exercise that people are taught when they're pregnant to try to strengthen their pelvic floor. We do biofeedback in our office, which is a formal form of education, and there's more than just standard Kegel exercises that we teach people. My approach to treating patients is really very individualized. I like to start by just listening to what the patient has to say and try to find out from them what kind of situations create a problem. Is it urgency? Is it activity, playing golf, playing tennis, etc.? And oftentimes the patient will lead you to what's going on if you ask the right questions and listen. After you've seen the patient, then we do an exam. Oftentimes there's some testing that's done. Most of the testing that has to be done we can do in the office, and then we come up with an individualized treatment plan. Most of the procedures to treat incontinence are relatively minimally invasive. Almost all are done as an outpatient, and some don't even require significant anesthesia, just a little sedation. It's a very real problem that deserves being treated.